Hi, good morning, everyone. Welcome to Eldercare Academy's training series. I'm Adrienne. I'm the digital marketing director here at Eldercare, and we are super excited to talk Cigna Medicare today. We love having special guests on with the carrier itself. So this morning we have David Raymond with us, and we're really excited to have this conversation, and that's what we want it to be. We want it to be a conversation. So if you're on the Zoom live with us, find the Q&A box. It's not the chat box. That doesn't work. It's the Q&A box. Tell us good morning. Tell us what state you're in, because we would love to talk, specifically where you're at. And if you're on the Facebook Live, which I know is having issues lately, just find the comment box and hopefully we'll see them. We got Brian, howdy, Georgia. Good morning, Brian. Good morning, Vicky, Illinois. All right, so everything must be working smoothly. Thank you so much for taking the time to be with us this morning. I always love having Cigna on. I've even wore the colors today, if y'all can see that.
Ooh, I like that.
I like to match, brand when I can. But today's conversation, I think David's going to go over kind of what makes Cigna stand out. I did notice a lot of the spreadsheets that I don't know if you saw this, David, but CSG releases spreadsheets every month about what plans are competitive in what areas, how many were written, things like that. And Cigna's always on the board. So I just want to throw that out there. And if you're not writing Cigna, then there might, we need to see why, because obviously other people are, and we need to see
What are you even doing?
what it is. Fred, good morning from Florida. All right, thank you. Thank you so much. I see people slowly jumping on. Thank you so much for taking the time to be here with us. As always, communicate with us, ask questions. Don't hesitate. I'm going to be asking questions, but I'm going to pass it to you, David.
Oh, okay, I'm up. Uh, Thank you so much, Adrienne. Always a pleasure to chat with you. Um, Vicky, Brian, Fred, glad you could jump on board. Brian in Georgia. I am also in Georgia. I live in Atlanta, so it's good to see another Georgian in the area. Ooh, Chantel from Arizona. We're gonna be talking about Arizona today too, and Illinois. I don't have plans to talk about Florida or Georgia, but I would love to, so we can
Okay.
get there. Um, I'm going to go ahead and share my screen. And today I want to talk about, those markets where Cigna honestly just killed at the AEP. And I'm going to talk about why Cigna, where Cigna, who to talk to at Cigna, all the pertinent information. So I'm just going to go ahead and get into this. So let's talk about why and where Cigna. Before I do anything else, here's a commercial I want to put out there. That's right, this has a commercial. There is a guide we put together called the Broker Resource Guide. It is lengthy and it is full of great information about who to talk to when you have questions. It has the member service information for not only current existing members, but new members. We have a different contact information for new members. So it puts them higher up the food chain because we know they might have more pertinent questions. So there's a different phone number for new members with Cigna, and that information is in here. All the information about our benefits, our Cigna supplemental health benefits. So how to utilize the gym membership, how to take advantage of our dental allowance, you name it, it is all on there. So this is a very helpful piece of information. I'm going to make sure that it's in Adrienne's hands after this call, and she can give it to all of you. If you want, you can send me requests from me as well. I'll send it to you there too. Either way, I'm happy to do anything that works for you guys. But if you don't
Yeah.
have this saved on your computer, you're missing out.
Yes, I use it all the time. It is lengthy, like you said, but Control F is
Mm-hmm.
the best thing ever. So if you're familiar with that or not familiar with it in these really large PDFs, which even Cigna sneak peeks are really long,
Yeah.
Control F.
National company. Yeah.
But I kind of prefer it that way. Even though it's a large file, I love just having it all in one place. I
Mm-hmm.
love not having to download so many different PDFs. It's all in one, and I can just do Control F and find what I'm looking for.
Exactly.
So
And a
thank
table of
you.
contents is a link. So if there's a particular
Mhm.
chapter you're looking for table of contents, just click on it. It'll take you right there.
Yep.
So bam. All right, there's my commercials over. So Den, let us know if you want this. We'll put this in your hands. Okay, so it's real simple. Why and where? So we're gonna start with who. All right, we're gonna talk about why, talk about where, and then we're gonna hit who again. Real simple stuff here. So let's talk about who first. The who is me. My name is David Raymond. I am the National FMO Broker Strategist that works closely with Eldercare, with Adrian and Jeremy and all the Eldercare people. They're lovely people. That is my contact information there on the screen. This is a photo of me last year getting married. I highlight this just to show you that if someone as ugly as me can get someone that hot, I must be doing something right. I must be good at something. So keep that in mind. I'm not just an ugly face. I'm more than that. Okay. All right. Now let's talk why Cigna. First on board, we're on an upward trajectory. So here I can show you that this is our AEP, just AEP MA production over the last 4 years. You can see that last year was our best AEP ever. Okay. Part of that was we've always taken a conservative approach to our plan designs. Okay. It is always about the core benefits, the core supplemental health benefits, your dental, your hearing, your vision. We're not about gimmicks. We're not about the shiny object to go, the tent you're going to get or the cleats, the golfing cleats. That's not how we operate. We build it all about making the benefits as strong as they can be. So given the headwinds that we've had in the MA space the last couple of years, that conservative approach has really paid dividends for us this year. That's why we had such a great AEP. We actually had over all national carriers, we had the third biggest membership growth of all of them. Okay. So again, very good year for Cigna. This is the year to jump on board. A few more good reasons. We are paying commissions on our Saver RX and our Extra RX PDPs. Okay. So the Saver and the Extra, we're paying comp on. We are not paying commission on the assurance. So you can write that if you want, but we're not paying commission on that. If you wrote the assurance plan last year in 2024, we are paying renewals on it. Okay. The HRA value-based enrollment. And Adrian, just chime in if you have something to say. I'm going to keep talking until you say something different. So
Okay, you're good.
Right, you're here. So the health risk assessment / value-based enrollment. If you do those with Cigna, for every app you get an extra $125 for our HMO and our PPO and $175 for our D-SNPs and C-SNPs. Okay. So 75 bucks for the HRA, 50 bucks for the value-based enrollment. The value-based enrollment is doing the app electronically. We don't care how you do it. You do it through Medicare Center, Sunfire, what have you. If you give us a valid email address and a valid PCP, 50 bucks in your pocket, plus 75 for the HRA, 125. Similar situation for the SNPs, except it's 125 for the HRA with a SNP and 50 bucks for the value-based enrollment. You have 10 days following app submission to complete the HRA. And there should be a link as soon as you do the app on Medicare Center. It takes you to you click on it and it takes you right to the HRA on Sunfire. So that's also a thing.
Yes,
Next.
and you give agents time to get it done.
And 10 days. Yeah, exactly.
Yeah.
Although you should just do it the day of because you have them right in front of you. Why not just get it done? But yeah.
Yes.
Yeah. Competitive RX. So on all of our HMO plans, we have no drug deductible. Okay. Most of them don't have a medical deductible either. We have a copay structure on our drug tiers 1 through 4 with all of our HMO. So again, on tiers 1 through 4 is a copay. There are no percentages there, which saves people a lot of money. And also there's one formulary for all of our HMOs and PPOs. So if you're selling in different states, you don't have to worry about the formulary changing. It's going to be the same across the board.
That makes it easier.
Right? I mean, they didn't ask me, but that's what I would have said I wanted. Full Part B give back plans. They are available in several states with us, including Arizona, Texas, Alabama, Tennessee, North Carolina, South Carolina, and Pennsylvania. So Chantel, I'm talking to you in Arizona. Okay. Very competitive full Part B give back. We do have Part B give backs in Illinois and Florida as well. Very competitive. Okay. We offer a full dental allowance in many of these markets. That is first dollar coverage on everything except for cosmetics and orthodontics. Covers implants. Yes, implants, crowns, etc. It covers everything at 100% up to their dental allowance limit. So if you have $4,000, you're not going to pay a dime of your own money until you go through that $4,000. Okay.
Wow.
Right.
The picture kind of
Yeah, the
makes
picture's a little weird, but like that's an implant. I just wanted to make sure that everyone understood. I don't
that.
love that picture. I don't like looking that close to someone's teeth, but
But I mean, that is a number one question, like with
hey,
agents, if it covers implants and then if there's any clauses to that.
it covers implants. Bam.
No, no clause.
No cost. Covers implants.
No.
As long as you need an implant, as long as you're not pulling your own teeth out to get an implant, we got you. Okay. Uh, last item I'm going to cover: $0 copay for diabetic monitoring supplies. Okay, this is something we don't talk about enough, and I don't know why. For blood sugar monitoring or continuous glucose monitors. Okay, $0 copay for those, including the supplies to get them. So that includes the Freestyle Libre 3, the One Touch Ultra 2, the Dexcom G7. They had a commercial about that last Super Bowl, the Dexcom. It was a big deal after that. All of those are $0 copays to get those items.
On all plans or
All plans.
built in, all plans. Doesn't
Built
matter.
in all plans. Mm-hmm. So that's something we're talking about right there. Get your clients looking, if they have diabetes, if they're looking to get a good glucose monitor, we're offering them at $0 copay on all of our plans.
A digital marketer, I'm looking at this slide as I need to be marketing give back plans, maybe marketing dental benefits. I'm going to be marketing diabetic benefits.
You know, it's
I think Cigna helps agents market that.
I think that we do. I would love to have those conversations with any of the agents who want to talk about that. So we'll talk about that later, guys. All right, enough of that stuff. Let's talk about where Cigna. Okay, I got a top 10 format here for where we sold the most during AEP, because these are the markets we had a great AEP because it's in the top 10 list. I do have to give an honorable mention before getting top 10 though, and that is Central Arkansas. That does feel slightly targeted, and you're right, but I did want to bring it up. Central Arkansas. Okay, why there? We added Bannister LeBlanc to our network to solidify our Cigna network there. As far as I understand it, according to talking to my local guy Ben, shout out Ben.
Ben.
We are the only thing we're really missing, and I know it's a miss, is Baptist. Okay, but our network otherwise is very solid. We are working on getting Baptist. It is something we talk about relentlessly. Okay. All of our plans, again, offer $0 medical and RX. All of our HMOs offer $0 medical and RX deductibles. And again, the copay structure on tiers 1 through 4. Top plans here are going to be the preferred Medicare and the total care D-SNP. Now, I'm going to show you a bunch of these slides that look like this. It's going to say preferred HMO and then go through some highlights. This is to get repetitive as all can be. So I'm going to try to be quick about this, but also point out the things that matter. So I don't want to bore you to tears, but I also want to give you what matters. So it's a delicate balance I'm trying to fit here. So just hang with me on this. If you have follow-up questions, just write them down real quick and hit me up later. Happy to follow up with you on that. Okay, Central Arkansas. The preferred HMO was our number one plan by far in this area. I think it's like 70% of our production thus far is this plan. So this is the one you're going to want to write. Okay, low copays and cost shares, offering $1,400 in dental allowance. And again, that dental allowance, it is first dollar coverage, covers implants and everything up to that $1,400. Okay, it can be used with any dentist that is willing to bill Cigna. That's another fun thing that we talk about is any dentist that's willing to bill Cigna that is not on the Medicare naughty list. Okay, that's an important distinction. Most doctors are not on the Medicare naughty list, but that's one thing we have to say. They're not on the Medicare naughty list. They can use this dental allowance and bill Cigna directly. Also offer $45 a quarter in OTC. And every slide is going to say this, but it's very important. Copay structure on tiers 1 through 4, no medical or RX deductible. Moving on. Total Care HMO D-SNP. This is for partial duals in Arkansas. Okay, $2,500 in dental allowance, $400 in vision, $100 a quarter OTC, $225 in our living needs allowance. The living needs allowance means you can use that towards covering your utility bills, groceries, gas, bus pass if you don't have a car, and cleaning supplies. That's another thing they throw in there. So if you want to get cleaning supplies, you want to buy just a lot of bleach, we got you. Okay. 41-way trips, no medical or RX deductible. This is the second most popular plan in Central Arkansas with Cigna. All right, let's get into the actual top 10 now.
I mean, aren't
Number
you
10.
forgetting about Central Arkansas though?
Sorry?
Aren't you forgetting something about Central Arkansas?
That it has a wonderful group called Eldercare Insurance Services in it and the best people in the world.
Yes, yes,
Okay,
exactly.
that's the one. Yeah, that's totally true. I do enjoy visiting hot springs. I would stay at the Hilton right along that road. I like that area. That place is awesome. They have the best candy store in the world.
Yes, we do.
I love that place. Okay, let's talk Chicago. Why Chicago? Well, we invested in the preferred HMO and the preferred savings HMO. When you hear savings, think Part B buyback plan. If it says full savings, think full Part B buyback. But that's not Chicago. In Chicago, we're talking, and I'm talking to you, Vicki. In Chicago, we're talking preferred and the Part B buyback. We brought Trinity back in a network as of January 1st, which is a huge get for us. I know a lot of our competition is missing them, as well as Endeavor. So that puts us in a very positive position. Top plans, again, the preferred and the preferred savings. So let's talk about the preferred. This is our traditional HMO, low copays and cost shares, 2,300 MOOP, 315 vision, 140 a quarter in OTC. Last time I'm going to say this because it's going to get incredibly repetitive, but I'm going to say it one more time. Copay structure on tiers 1 through 4, no medical or RX deductible.
I think everyone on this training will be able to teach everyone else about Cigna Medicare.
And that's the dream, Adrian. I'll just hand you this.
You got to say it 3 times before you remember it.
It's almost like I'm repeating things for some reason. I don't know. It's weird.
And I see that a lot of people joined on after we started. So if you joined on later, please find the Q&A box on the Zoom and put in the questions box what state you're in, because we want to talk specifically where you're at. So
yeah, I have that pulled up here over on the right screen. I'm looking at the left screen. I see my camera right here. So I got all 3 screens covered. I am swerving to catch everything. So put your information in there. I'll be sure to cover more information, anything you ask about. Or I'll pass off to Adrian because she's also an expert on Cigna. All right, for the preferred savings in Chicago, this is our Part B buyback plan. Okay, it's $100 a month Part B savings. That's $1,200 a year. I can do math. $105 a quarter in OTC. Copays on tiers 1 through 4, no medical or RX deductible. So again, this is $100 back on your Part B premium a month, no deductibles. Save money on drugs, great core benefits, solid plan in Chicago. And we're moving on. Number 9, Mobile. Okay, Mobile. About 3 years ago, we lost a major hospital system called Infirmary down in Mobile, which hurt our business. We have it back. That is a huge gain for us, which is why this is number 9 on this page on our top 10. Also, we have new broker sales manager, Lisa Bond. She has a great relationship with all the brokers down there. I don't normally highlight a broker sales manager. The fact that I did here means that she's that good. So make sure if you're in this area, you're talking to Lisa. Okay. Also, we have a new full Part B buyback plan in Mobile. Okay. Again, it's going to pay their entire Part B premium. Top 2 plans in Mobile are the preferred or traditional HMO and the full savings, full Part B give back plan, the Cigna preferred full savings Medicare HMO. So talking about the HMO first, again, low copays and cost shares. That's a theme of our HMOs, saving you money, okay? $1,500 in dental allowance and the usual copay structure and no deductibles, okay? Again, new plan for this year, the preferred full savings. We have this in 10 markets, if I remember correctly. Full Part B give back. So saving them all of their money on their Part B premium. Still offers dental, vision, and hearing, and OTC. No deductibles, copay structure on tiers 1 through 4. See, I'm trying to be considerate here and not just repeat all the good stuff, but it is that good. It's hard not to repeat it.
Yeah, it would make me want to get my license in Alabama.
So true. Connie, I see you in Little Rock. I hope you didn't miss the bit about Central Arkansas because it was a good bit. If you did, let me know. Happy to send you what you need. Uh, ooh, yeah, South Carolina as well. Not on my list per se, but South Carolina, we have a fantastic Part B buyback plan, full Part B give back plan. Okay. Number 8, Philadelphia. Is that Levon? Like Levon Elton John Levon? That's cool. That's a great name. Okay. Sorry, Philadelphia, number 8. Competitors are degrading their benefits. They're losing membership. I'm not going to name names, but some big ones. We added Tower Health and Trinity back into network. Point being, we are positioned to win in Philly. Okay. We have a new full Part B give back plan, the preferred full savings, and we have our traditional HMO, both very competitive. Let's talk about them quickly. Again, the HMO, low copays, cost shares, $1,250 dental allowance. That does have an in-network only, so you got to be in network for that one. Only in Philly have I seen this. $1,500 for a bathroom safety device. That is a lifetime allowance. Okay, so you only use it once. You can't keep going back every year. But anything you need to make your bathroom more safe or pretty, as long as it's both, helpful and aesthetically pleasing, it's fine. Okay, put that in your bath, help make your bathroom more safe for yourself. $1,500, it's an allowance. So again, first dollar coverage on that. Copays on tiers 1 through 4, no deductibles. Now let's talk about the big plan, the big hit, the big hitter in Philly, the full Part B give back plan. Okay, again, covering your full Part B premium, still offering dental, hearing, and vision, $1,500 in dental allowance. Copays on tiers 1 through 4, and even though we're giving you back your entire Part B premium, still no deductibles. Okay, catching the theme here. The same plans keep coming up because these were the ones that won this AEP. All right, let's talk about Charlotte. It's not South Carolina, Levon, but it's close. Charlotte, full Part B give back plan. Our competition regressed just across the board. A lot of that's due with the fact that medical loss ratios were a little bad for some of our competitors. Ours still in a very good position. If you look up medical loss ratios, percentage-wise over right now as it stands, we are in a very good position compared to some of the other national payers. So, point being, we're in a position to win moving forward too. We have a strong network compared to the competition as well. So again, preferred Medicare, preferred savings. Okay, preferred Medicare, traditional HMO, again, low copays, cost shares, almost $2,000 in dental allowance, 31-way trips, no deductibles, copay tiers on 1 through 4. Great option for those who are going to be high utilizers, maybe save you some money. If you're a low utilizer, if you're new to Medicare, if you're healthy, you barely go to the doctor, that's what these preferred savings plans are for. They're for your healthier clients who don't go to the doctor a lot, so they won't save a lot of money by using a traditional HMO, but they want to save on their Part B premium. This plan is nearly your entire Part B give back. I say nearly because it's not going to go up to meet, it's $174.70. Okay, so I actually don't know what the Part B premium is off the top of my head. I should, but I don't. So it's going to pay $174.70, so maybe a couple bucks Part B premium you're going to pay a month. That's it. With that, you get all the DVH, dental, hearing, and vision, and no deductibles.
It's $185.
Thank you. See, that's useful information. So for okay, so about $9. About $9 on your Part B premium. Still pretty darn good.
Nearly is a good word.
Nearly. I was very clear not to say full. Nearly. Okay. All right. Nashville. This is a full Part B give back. So it's not nearly, it's the full Part B give back. Nashville was the home base of HealthSpring, which is, one of the big key parts of Cigna's Medicare base. This is where they go to train me or verbally abuse me. So always where I end up, Nashville. Preferred Medicare HMO and the full savings Medicare HMO. Low copays, cost shares, got the $2,200 dental allowance. Very great plan, $200 in vision. Again, strong HMO for your high utilizers. Those are going to go to the doctor. For those who don't go to the doctor, full Part B give back plan. Still has dental, hearing, and vision, no deductibles. Moving right along, we're at the Valley now. This is South Texas. Again, We have two Part B give back plans. We have the full and the partial, okay? So depending on your needs here, we got you covered. The preferred is $125 a month in Part B savings, or $1,500 a year. Still has $1,500 in dental allowance, $200 in vision, et cetera, no deductibles. The preferred full savings, you can save all your Part B, still get dental, hearing, and vision, and no deductibles. Try and move along because it's getting competitive. It's getting repetitive. Okay, Birmingham. Again, in Alabama, very strong market for us. We added UAB earlier in 2024, which is a big win, a huge hospital system in this area. We have strong brand name recognition. It's still one of our legacy markets. We've been here forever. So we have a lot of, people on our plans here. Also, new full Part B gift back. Okay. So again, traditional HMO and the full savings HMO. Low copays, cost shares, $1,850 in dental allowance, no deductibles. The full savings, we're going to save you all of your Part B premium. You still get $1,200 in dental allowance, $225 in vision, no deductibles, copay structure on tiers 1 through 4. We even give you OTC on this. We're paying your entire Part B premium, and we're still giving you OTC. Man, that's generous. Okay. Number 3, Dallas. Okay. I'm a huge Dallas Cowboys fan, as you might see. I got this Troy Aikman jersey over here. So point being, Dallas is number 3 for a reason. It's because I put a lot of time and energy into this market. Okay. Great network, strong plan offering for 2025. And again, the competition had to degrade benefits because of their medical loss ratios, et cetera. So we have a traditional HMO and the Part B buyback plan. Traditional HMO, low MOOP of $2,600, 0 PCP, 30 specialists. Again, so they're going to save money when they go to the doctor. Copays on tiers 1 through 4, no medical or RX deductible. This is one of our plans that doesn't have a dental allowance. It has the $20K dental HMO. Okay. What that means is, for all your preventative stuff, no cost. If you go in for comprehensive items like implants, like the crowns, et cetera, you're going to have a copay, but we're going to cover everything. We're going to cover outside of that copay up to $20,000. The reason we put $20,000 on it is because before it was unlimited, and the way that CMS does their Medicare.gov ratings, not having a dollar amount makes it less competitive to them. So we had to put $20K on it. So it really doesn't matter. The numbers are irrelevant. The highest we've ever gotten, someone's ever utilized our DHMO 20K is $1,400. So again, this is a fantastic option for your clients. $215 vision. Adrian, you look confused. Do you have a question?
No,
Am I talking too fast?
No.
So I might. Okay. I live in Georgia, but I'm from the Northeast, and the fast talking comes with that.
It's so like Dallas. I'm just processing. Like we haven't heard this plan yet, or heard these benefits yet. So it's specific to Dallas.
It's in several markets, but our dental allowance is our number 1, and it's in a lot of markets. But for those markets that don't have that, they have the $20K DHMO. Both are good. They're just different.
Okay.
The preferred savings. So this is a Part B give back plan, not the full Part B give back plan. That's in Houston, which we'll talk about in a second. But in Dallas, it's $125 a month Part B savings. So it's $1,500 a year. Still has a $20K DHMO, $150 in vision, copay structure on tiers 1 through 4, no medical or RX deductible.
I think you're playing favorites with Dallas.
I might be. I mean, the Cowboys have been breaking my heart for 30 years, but I'm still a fan. Man, they suck. Okay.
I need to ask like any agents on this training, if y'all want the Dallas plans, let us know. Because I'm gonna say David can make that happen.
I got you. I'm seeing here Nashville loves the full savings give back. So love to see that. It is a hit. See, you're getting it from people on the call. They know they love it. If you want to talk more about that, I'm on board. Also, I'll give you your $20 later. Okay. Now let's talk about Arizona. Central Arizona, this is a legacy market. This is our oldest market. Okay, we've been here forever. So Cigna had a MA plan in Arizona and a bunch of other states. They left every state except for Arizona, and then they came back to all the other states. This was like, I'm talking like ancient history, but I'm bringing it up. So again, legacy market, we've had a 4 stars or better for 14 plus years.
Wow.
We have all the major providers in network in Central Arizona, except for Mayo. Okay. Evernorth Care Group is owned by Cigna Healthcare. If your clients, I mentioned that for a reason, we have a 95% plus retention rate with our membership in Arizona. If your client goes to our Evernorth Care Group, it's 98% retention. Wouldn't it be
Wow.
nice to have a plan that has a 90% retention rate? You put them in this plan, you know they're not going anywhere because the customer service is that good. That's here in Central Arizona. We kill it here, okay? And I'm going to show you why in a second. There's 3 plans we're talking about. 3, okay? Let's talk about the Alliance plan. Am I doing on time? Okay, good. Alliance, ideally suited for those interested in rich benefits. This plan is tied to Evernorth and our value-based care providers. Low costs, low copays, cost shares, and MOOP. 2,300 MOOP, 0 PCP, $5 specialist. This plan even has a Part B give back of $5. I can tell you that is just a marketing gimmick. It's just so will show up on the list when you look for Part B give back plans. But still, a very great plan. And you get $5 a month. Okay. $3,000 in dental allowance, $500 in vision, $125 a quarter in OTC, no deductibles, copays on tiers 1 through 4. So if you have a client who uses a value-based care provider in Central Arizona, this is a plan for them, especially if they go to the doctor a lot. Okay. Then we have our traditional partial Part B give back plan, $105 a month. Let's use $1,260 a year. Still offers a dental allowance of $1,300, no deductibles, copay structure on tiers 1 through 4. Our number 1 plan for this year in Arizona is a new plan. It's the full Part B give back plan. So again, paying your entire Part B premium, $500 in dental allowance, still offers vision, still offers hearing, $25 a quarter in OTC, and again, no deductibles. Okay. Number 1, numero uno, Houston. Okay. This is our largest micro market by far by membership. We offered the full Part B give back plan, new for 2025. Also, it has the Alliance plan like Central Arizona. This one of our top 2 plans, top 2 micro markets, both have the Alliance plan. There's a reason for that. That plan is great. Okay. So let's talk about Houston real quick. The Alliance plan, again, tied to our value-based care providers, low copays, low MOOP, $2,600 in dental allowance, no deductibles. Great option for your clients who are going to the doctor who really want to utilize their benefits. For those who just want to save a bunch of money, we're offering the preferred full savings. We're going to save them their entire Part B give back. Their entire Part B premium. They still get dental, hearing, and vision and OTC, no deductibles, copay structure on tiers 1 through 4. Okay, let's move along. Look at that. That's nice. Okay, again, top 10 markets: Chicago, Mobile, Philadelphia, Charlotte, Nashville, the Valley in Texas, Birmingham, Dallas, Central Arizona, and Houston.
But you're in more than that, obviously.
Obviously. And that's a great segue. As you can see on the screen, every state in green is where we have a Medicare Advantage product. Our PDP is everywhere, but our Medicare Advantage product is in these areas. If it is blue, that is one of our focus markets. This means a place we are designed to win. Okay, so this is beyond just the markets I showed you. If they, on the left, if you see they're bolded, it's because they have a Part B give back plan. So beyond just what I showed you, the top 10, we are competitive in a lot of markets. Okay. If you have questions about any one of these markets, please let me know. I can talk to you about it. I can put you in touch with your local team, your local market experts who know more than I ever will. Whatever you need, I got you. So let's talk about contact information. Now, Carl is not one person. Carl is the Cigna Agent Resource Line. They are there for you. Okay, so you can call them. If you scan that QR code, they'll put them right in your phone so you can save that information. They have an email address. Also, if you're utilizing Cigna's Salesforce capability, so if you go into Cigna for Brokers and you click on Salesforce, there is a click to chat button. Okay, it is not highly utilized yet. And I say yet because it's relatively new. So If you go there and you click on that, you are going to get immediate service. You won't have to wait for anything. It's going to be immediate. So I would use that click to chat button while you can, because you don't have to call anybody. Just click on it. You have a little text conversation. They'll answer your problems for you. It's perfect.
What we use in the office all the time for agents.
Say. Carl can do everything for you. Okay. Application status. They can check on Medicare and Medicaid status. Reset passwords. They can help you with commissions, licensing, and appointment questions. If your customers are missing an ID card or a welcome kit, you can request that via Cigna on behalf of your customers. So all kinds of helpful things that Carl can do for you. Okay. Also, we have a contact sheet for the local market. So depending on whatever market you're in, we have a BSR, probably several, who can help you out. On top of that, and another underutilized service is we have a virtual broker sales managers. These are people who work in several states, who are market experts in several states, but they don't go to all the events and go out to coffee to meet brokers here and there. So they're not, they're going to be more available. They're in front of their computers more often. These guys are fantastic. Okay. So, make sure you guys utilize your VBSRs, your virtual broker managers. If you need this information, again, I'm going to send it to Adrienne after this call, and she can make sure to put it in your hands, or you can ask it for me directly. I do love being talked to. I am ever so lonely.
I'm really hoping that every broker on here already has a relationship with their BSRs, what you're calling them. And but if not, like, let's say we have like a brand new agent and they want to reach out to their broker manager, like how would they reach out? Like, what should they say?
So if they're an agent and they want to talk to their local broker manager, here's what I do. As a former broker manager, I would love a call, honestly, because I'm almost 40, so I'm gonna still admit I love a text message or an email. Any one of those will do for me. But text message always gets me because I feel compelled to answer right then and there, because I'm not going to remember that I got a text message. So if I don't answer then, I'm probably going to forget. So I answer text message immediately. And I know a lot of my BSRs do the same thing. So text, call, email. Say, hey, I am a broker in your market. I want to write more Cigna. I just need a little bit more help. Let's meet up for coffee. Let's go and jump on a WebEx. I guarantee you they'll do it. They'll take you out to coffee, get a free meal at it while you're at it. Okay. And they'll help you out with any questions you have about the plans. They'll talk marketing with you, marketing strategies, how to get in front of people. We're doing a lot of T65 meetings. And if you show some promise to our local BSRs, they'll help you out with that as well. Okay. That means we cover a lot of the cost for you. Usually we ask only the brokers cover the food. So reach out to your local BSR, say you want to do T65 meetings. I would recommend getting a couple apps under your belt before you do that, though, because, it's hard to give money to somebody who hasn't at least written one app with us. But once you've written a couple apps, say, hey, this is what I need. But meet with your guy. Make yourself known to your BSR. The more you're in front of them, the more they're going to think of you when they're handing stuff out, okay, including co-op. Does that answer your question, Adrienne?
Yes, it does. Thank you.
Perfect.
And I really want to stress, like, because you're saying T65 right now, because there's a lot of compliance with marketing right now. I mean, technically we're still in OEP. You can't market OEP. You can't market duals. You can only market specific special enrollment periods. You can only market turning 65s, and you can market 5-star plans if you have that capability. So
we used to. Oh man, I missed that 5-star plan. It's so good.
yeah.
It's only 4.5 stars now. Man, that's such a good plan. It's still a great plan, but the 5-star was fantastic.
But still, 4.5 is
still 4.5 still really good. Okay, the H4510 is an amazing plan.
Yes, yes.
Say something. I blanked on it now. Oh, and specifically about T65, because during lock-in is now more lock-in than it ever was before. Okay. And I do see your question, and I will answer that in 1 second, I promise. Okay. Because you have to have an integrated DSNP to write it outside of AEP or OEP. And because LAS rules are different, okay, it is going to be more important that we focus on T65 moving forward during lock-in periods. It's a great way to build your base for AEP. It's a great way to just write some business during lock-in, okay? So again, talk to your local broker managers about how to get in front of them. They have 1,000,001 ideas. Most of them are former brokers themselves. They know how to do it. They're just too lazy to do it, but they'll help you, okay? So definitely make sure you reach out to your local broker or manager. Okay.
Yes.
I
And
do see.
we
Mhm.
give our agents, if you're doing business with us, we give you free turning 65 data. So you can pull that data and work with your broker manager on what to do with that data. And then, as you mentioned, integrated plans. I just want to put the plug in for Cigna. I am so grateful for Cigna and the emails. I don't know if you're doing them, David, or
It's me.
who's. Yeah, I figured it was. Um, the emails that are, educating us and agents on all the different changes. You're quick to get it in the inbox, and I have a whole folder bookmarked to just industry news like from Cigna. So thank you for doing that and making sure we know what's going on. And if you're not getting Cigna's emails or um you're missing them, what should they search for, David, to find those emails?
Uh,
Do you know
so
the email
I
comes from?
I send those out to. Okay, I think we're talking about different things now. Now I feel bad for taking credit for that. So we send out those emails on a national level to things about SEPs. Is that what we're talking about, like SEPs and updates? Okay, I don't send those ones. I can take credit for that. Those are all available in Cigna Producer University.
Okay.
Okay, okay. We put all our communications are there, so you can always access them that way. If you want to be added to if you're not getting them now, you want to be
Mhm.
added to that distribution, get appointed with Cigna. Okay. And if you're appointed with Cigna and you're not getting them, it's because at some point you opted out. And let's unopt you out. So reach out to your BSR, tell them you're not getting those emails, and then make sure you get
Yeah.
it. Okay.
Okay.
I also want
Great.
to shout out Trish Berry, our new BSR in Northwest Arkansas. She's on the call. Good morning, Trish. Good seeing you.
Good morning, Trish. Thanks for being here.
Vicky, I will get you those BSRs for those states. We'll get you this local BSR list. So we'll take care of you there.
You mentioned
Uh,
Alabama too. She
Vicky, like Alabama's a great market. Kentucky, we're only in northern Kentucky. It's part of our Ohio market. It's fantastic. Arizona, like I said, can't go wrong. Illinois and Chicago were great. We'll talk about these, Vicky. We'll take care of you. Chantel asked a question. Does a client who has Cigna through their employer get a discount if they get Cigna Medicare Advantage or supplement when they transition to Medicare? Oh man, that'd been great. I wish they did. No, they do not. But that would be so cool if they did. I would love that. Because Cigna has an amazing employer group benefits. I'm sure everyone knows that. Some of you probably have your employer group benefits or your private insurance through Cigna because that's a huge part of our business. It is the biggest part of our business. Um, no, there's no discount for switching to Medicare off that, although it's always a good idea because who took care of you while you were employed? Cigna. So, just stay with that. Um, and do you know what the average person spends on dental care? I do not know off the top of my head. I know it's significant, but it also depends on the plan. It depends on, how much they're getting from their coverage. It's a complicated answer. I don't have that off the top of my head. Yeah, I couldn't give you that, I'm afraid. Thank you, Trish. I appreciate that. All right, let's move forward. Okay, let's talk MedSup real quickly because my buddy John Salve is your guys' broker sales, your CSB rep, and you know that guy's a good person. So let's talk about some plans here real quick. In 2024, we have 14 new charters. So this was in 2024 last year, including Texas and Arkansas. So these are new MedSups for Cigna in these states. You can see all of them right here. Okay, Kansas, Montana, Tennessee, huge, basically refreshing all of our MedSups. So we're always going to come in strong. Remember that. And then top MedSup states: Missouri, New Jersey, PA, Florida, Texas. Again, Texas, okay? Ohio, Arizona, Illinois, Indiana, and Colorado, okay? Those are our top states by sales. Speaking of John, that's John. If you have any questions about Medicare supplement, hospital indemnity, critical illness, dental, hearing, and vision, short-term care, talk to John. He's a great resource. He used to be the BSR up in Pittsburgh. He's worked with him very closely up there. Now he's transitioned to the CSB side. You're lucky, you guys are lucky to have him on that side of the house. Quick note, the Cigna supplemental benefits contract, the MedSup contract, is separate than the MA and PDP contract. So if you want to write our MedSup, but you're not contracted with the MedSup, talk to Adrian, talk to Eldercare, get that appointment through them. and then call John and say, hey, I just got appointed. Where I'm a share rate business, and he'll tell you all the great places and all the great products because he's a market expert on that.
Yes, and if you're not sure if you're already contracted or not, please reach out to us and we'll see if that's active. We'll see if you have both of them. We're happy to do that work for you here at Eldercare.
They're the best, and they have the best candy store. This is my contact information. If you go over the QR code, you'll have my information. Happy to answer any questions you might have that I did not answer on this call. We got an hour. What are we gonna do?
If you have
Thank
further questions, please put it in the question box. Don't hesitate. Like we want to know if are you interested in selling Medicare, Cigna Medicare? Like, let us know. Like we truly want to help you. And since you keep talking about this candy store, I am just gonna put the plug in that we have a conference in September. And if you would like to visit this candy store, you can while you're here for the conference.
We'll be at that conference.
Yes.
And I assure you, I'll be staying at the
person.
Hilton Water and then walking the one block down to the candy store. And I'm going to spend, last time I was there, I am actually embarrassed to admit this. Last time I was there, when I walked out, I had dropped $50 worth of candy in that candy store. I did not expect that at all. The wife and I have this thing. Every night we eat a piece of dark chocolate. Okay, it's our guilty pleasure. After dinner, go for a walk, and then we eat a piece of dark chocolate. So I bought a bunch of different kinds of dark chocolates and brought it home. And then I bought some gummies for myself because I'm a gummy fan. I love gummy candy. So I dropped $50. I shame ate some of that some night. Some of I brought it home. So don't make me eat this candy alone. Come to the conference.
Come to Eldercare's conference in September and see David and go to the candy store.
I will tell you, we'll set up a time. We'll all go there together. It'll be great. It'll be fantastic. Okay.
I love that so much. I do see people slowly jumping off. I just want to say thank you again for taking the time to be here with us this morning and learn about Cigna Medicare. And we are excited to be a part of the growth with Cigna Medicare. And I don't see any further questions coming through. So I know that we'll be following up after this. Melanie, Amanda, Josie, I think all three of them will be reaching out to you to see what supplies you need. We'll make sure you get the BSRs and the guide at the beginning. What's it called?
The broker resource guide.
Broker
resource guide.
Okay. So we have a BRG and a BSR, and it's.
We love. Oh, come on! You're in the Medicare space. Acronyms is where we live.
I know. This is how I remember everything. Absolutely. Well, thank you again, David, for taking the time to talk to us, and hopefully we've sparked some interest.
All right. Sounds great. Thank you so much, Adrian. I appreciate the time.
All right. Thanks. Bye, everyone.
Bye.